So if a patient goes to you, because you talk, there's two categories: the person currently wearing a denture, or the person that it's been determined all of their teeth have to be removed. So what are their options when it comes to dental implants in your office?
Yeah, so the first option, which is the more affordable one, is having simply 2 implants on the lower and having a denture that snaps in, snaps out of them.
Okay.
It's not an ideal option because the denture can still wobble a little bit, but it's better than a denture without any implants holding them.
Okay.
Because you've never wore a denture, but
No.
if you patients who wear dentures, especially the lower, it's not very secure in the mouth. They have to use a lot of glue to keep it in. Now, when you put these implants, it snaps it in. It's more locked in.
Okay. There is maintenance on those snap-ins. Is that right?
Yes, of course. You have to. Sometimes those snap-in rubbers, they wear out. They have to change them. We have to change them once a year or every couple of years or so. Obviously, hygiene. You need to come in for your hygiene exams and appointments to maintain them. The next step is you could sometimes do it with 4 implants to secure the back so it's less wobbly than before. The next step up is now we have a fixed set of teeth that does not come out.
So when you say fixed, meaning a full arch of teeth that are just on implants that don't come out?
Exactly. You don't remove them like you remove dentures or snap-in dentures.
How many implants does it take typically to do that?
It depends on how much bone, but usually 4 to 6 implants is the typical ideal number.
All right.
So those set of teeth, patients cannot remove them. Only I can remove them when they come in back to the office or any other dentist that works on these type of bridges. And they're able to clean them better. Usually a water pick under the bridge that will do the job. Obviously, they would come in twice a year or so to clean them in the office.
What about the upper teeth? How many implants and how well does that work?
So on the upper is even better because now you're not covering the palate. And if you talk to some patients who wear dentures, they're complaining of gagging. They're not tasting foods correctly. And they feel like this is a very bulky plate in their mouth that they want to get rid of. So you got 2 options there. Again, snap-in, snap-out dentures, which you could do 4 implants, and those it would look like a horseshoe, so you're not really covering the palate. You're not gagging. You're tasting foods better. And then the next level up, again, the same thing would be 4 to 6 implants with a bridge, a set of teeth that does not come out.
Okay, now can you eat anything you want, like bite into an apple or with your front teeth, or you have to be careful with those front teeth?
Once we have those zirconia teeth in, you could eat anything you want.
Okay, and do they? Like nuts? I mean, you could eat whatever?
Just last week, my patient said, the first thing I did is I went to the next steakhouse next door, and I had to eat my steak meal because he wanted to do that for so many years.
Very nice. Now, correct me if I'm wrong on this one. How dental implants are typically done, especially in Connecticut, you go to one doctor that does the surgery, another office and doctor that put teeth on top, and then you get them maintained elsewhere. At your office, you do all 3 parts. Is that why you do it so quickly?
That's correct. We're able to do, with today's technology and techniques, we're able to do start to finish with me. There's only one fee. You're not paying 3 different fees for 3 different specialists.
Okay.
And I'm able to see the outcome before I even start working on you. So I have it in the back of my mind. I see with the smile where the end result is, and that's what we're working on. And that takes shorter usually. We're able to do that in 3 visits rather than having seeing specialists, which could take 1 to 2 years sometimes, and it still is for in other places.
You've traveled all over, and I don't want to exaggerate here, but all over the world learning implant dentistry. Like where? Like where do you travel to learn this stuff?
Just last month, I was in Portugal, learning techniques on placing implants for people with less bone. And with today's technology and techniques and long research of studies, it becomes easier and easier to place these implants with less bone.
Now you've done this on a 95-year-old or 92-year-old or something like that?
We worked on 95 years old patients, and usually the comment is, I wish I've done this a long time ago.
Does a patient ever come in at like 75 and says, I'm too old for this?
It happens all the time. And I tell them, you still got 10, 20, or 30 years of life and foods that you could enjoy that you wouldn't without teeth. The other thing that makes this faster is we invested heavily in our in-house lab and technology. We can literally take a scan in your mouth and print your teeth in the next room.
Is that right? So 3 visits, just so I'm correct, if everything works out. You meet them, you determine whether they're a candidate. Step 2, smile design. Step 3, you get your new teeth.
That's correct.
Has it ever happened that way, where you can do it
Most of
in
the time,
3 visits?
Most of the time, yes. Obviously, it's case dependent, but this is the protocol for the typical protocol that we follow.